Thank you very much for the opportunity to share a little bit about LAZ's story and why we believe that the work that we're doing in partnership with WellSpark is so important. So if you could go to the next slide, that would be great. I'm actually going to start with a little story, if you'll indulge me, to give you some context about why this work has become so important for us at LAZ. If I take you back in time, back to 2015, I personally had taken a trip to Bali, a little bit of a last minute thing, and sounds very eat, pray, love. It wasn't turn out the same way, but while I was there, I had an experience where the Wi-Fi was spotty and I was in a totally different time zone, and people on my team weren't calling me and asking me for help. You know, they weren't hunting me down in my hotel or calling the airline because they had decisions they needed me for. And it was the first time in my personal life where I realized, wow, I'm really married to my job. And that began for me a journey personally toward understanding the relationship between an employee, me, and other employees and their career and their identity around that and how that impacts their health and their well-being. And so I share that story to say, you know, through that process, you know, what Dr. Rollins and Bert were talking about related to the idea of wellness not being one size fits all and health not being one-dimensional. I've personally found over the last few years so many stories where that has shown itself in a variety of ways. I have an employee I worked with through this journey and found out that he was struggling with a situation with his child who was showing signs of depression and threatening suicide. And I had an employee on my team who was dealing with a situation around finding care for his child who had just been diagnosed with a disease, or having to deal with a team who was a new parent and needed to figure out how to navigate not only the new parenting part of the process, but the stress that went with it. And then having somebody I work with who has diabetes and was struggling with getting into a routine for how to manage his medication. And it goes on from there. And obviously, in my case, there's thousands and thousands of employees, all with a different set of circumstances, me personally included. So this was a personal journey that led me to an opportunity to say, wow, we could do this differently at LAZ and make a real difference. We're a people first company. And what better opportunity for us to demonstrate that people first than to build the types of programs that would really, over time, allow us not only to see impressive success with our cost of claims being self-funded, but also, of course, taking care of our people and being able to tell the story that that's really what it's all about. So what you're seeing on the screen are some of the things that we did and have been doing over the last few years, leading up to a year ago when we began engaging in some conversations with WellSpark. One of the first things that we began to do was create some value-based insurance design. And we knew, like, we could hire WellSpark, or we could have our own coaches, which we had already actually. And regardless, we needed to take a multifaceted approach, knowing that, we wanted a plan design that supported people making good decisions and, frankly, removing the financial barriers to getting care, which is what the value-based insurance design concept, at least from our lens, was all about. And so we began to come up with what we want, what kind of care do we want to make the most accessible, and how could we do that through the design of our plans. We began, obviously, some proactive outreach. We were already doing a little bit of this internally. We initially had 2 health coaches working for us full-time. Now, since have outsourced that to WellSpark, and one of our coaches went along over to WellSpark, actually, to work there full-time and support our employees. But through both the WellSpark model and our own ongoing education internally using the data that we get from WellSpark, we on a regular basis are doing a significant amount of outreach to get people engaged. Fixing copays for mental health visits was a big deal for us. Some of the examples I gave you, and like I said, the list can go on, made it really clear to me that people needed to know that not only can care be financially accessible, meaning mental health support therapy, be financially accessible, but also, it's not a shame. Don't be ashamed of it. In fact, we don't want you to be, we think it's so important that you get the care that you need that we're going to fix a copay across all of our plans to help you get there. And that's how we say mental health is so important, that we are making it accessible to. We have a lot of focus on health literacy at LAZ, and we do that in combination of the MySpark Central platform through WellSpark and the videos there, which we require a certain number of those through our plan design, which I can talk about in just a moment, and then through LAZ University, which is our own internal platform for delivering learning to all of our employees on demand. And we also offer some non-on-demand, so some synchronous experiences just like this one. We have targeted weekly communication to get our folks engaged across all kinds of topics, everything from how to access care to how to get educated to what does this acronym mean in the healthcare piece to how do you manage your diabetes. And we do things across our entire population. We do things that are targeted, and we try very hard to use the data to make good decisions to drive engagement across our population through our communication. And then, of course, integrating this biopsychosocial concept into our own learning, our leadership curriculum, our own practices within LAZ, so that it becomes WellSpark really and LAZ are an extension of each other. We're talking the same language internally as our WellSpark coaches are speaking to our employees when they're engaging. And the result of that is then we end up with this holistic experience. So I'll pause there. Before I go to the next slide, I'll just give you a little bit more background in terms of some of the things that might be on your mind as you're speaking to potentially some of the people that you would be sharing the WellSpark with. First, talking about the cost and how to overcome that barrier as an employer, because obviously there's a cost to all of this. And of course, you know, I would love to tell you that every CEO is going to be able to say, oh yeah, no problem, HR, go ahead and get that. I can see how it can offset the, be offset in the cost of claims. It wasn't easy for us up front. It wasn't nearly that easy. So, first we funded the cost of these programs by offsetting it with wellness credits through our health carrier at the time. We had an amount of money that we were getting for our wellness programs, and we offset it there. And then we began to quickly see results. And so put our business brain and HR around it and said, okay, well, if we're seeing results, how can we attribute that to claims? We are self-funded. We were able to come up with a formula that said if we save on these types of claims, if we increase the number of people getting preventative care, if we do these numbers of things, we can assume a certain amount of claim savings, and that's how we were able to demonstrate and offset the cost. And so we obviously have continued to use that same, we'll call it pricing model, to show why the cost of this is really negligible, because ultimately when we see, we have one employee not hit stop loss, for example, as a result of them getting coaching, then I know for certain we're nearly paying for itself. And we have countless examples over the years of how through coaching we've done that, and now over the last year, I'm already seeing many results through WellSpark so far. And in fact, as it relates to results, I'll just share that preventative tracking is already, preventative care is already tracking above average for us year to date in 2021. We're already seeing our claims tracking at least neutral to 2020, if not below, in terms of a cost per employee per month, and certainly below what we budgeted for 2021, which is obviously exceptional. We're seeing less hits to our stop loss year to date already, which is big news for us. And of course, engagement and coaching at an all-time high. So far this year alone have been pretty exceptional. And so, it's not just about saving money. It's a multifaceted approach that goes beyond just the idea of, saving money on claims, but what are we doing right for our people? Are we giving our people what they need to be as successful as they possibly can be and live in a more holistic way? If we go to the next slide, I can give you a preview of what it really looks like in concept with the health coach at the center. So, when an employee either through volunteering or having an interest by responding to one of the emails that we send or some of the outreach we do or the outreach from the WellSpark team, so, they can either through us reaching out or by them volunteering to engage, then it immediately goes to our coach, who from there would be able to, well, loosely use the word diagnose, right? But be able to identify what it is that this employee is looking to change, what kind of behavior can we influence, what are we trying to solve for? with this person, and then drop them into the system in the most appropriate way to help them to get to the right result. We're doing this obviously through lifestyle factors, the stuff you're seeing on the left-hand side of the screen, of course, and but also there's a significant amount of this that's chronic disease management through a cohort that's been identified by WellSpark, who they're actively outreaching to. We were able to have them look through our claims and say, well, where are you seeing historically the largest volume of claims as it relates to chronic disease? Let's see if we can tackle that group of people, and that's where we've been able to marry the difference between, or marry up the outreach as well as the outreach from LAZ. So I'm going to pause there, Andi. I'm not sure if I'm answering some of the questions I think you guys had on your mind for me to share, but I'll pause and see if there's any questions I can answer about what I've covered so far from folks who are attending.
We did actually have a question come in. I know you had mentioned data, and obviously you work with the health plan now. How did you negotiate with the health plan to get that starting data to really help you figure out what type of cohort, if you will, you would want to pursue using the WellSpark program?
Yeah, it's a great question, and something I think my peers in HR sometimes, more than sometimes, struggle with in working with carriers. And the reality is that data is our data. That is the data. We own the data. We own that claims data. That's our employees' information. As an employer, we own that. And I share that because what I implore my peers to do, and I know that I happen to be partnered with a broker who believes the same. We're just relentless. Like, we will get this data. However, if we have to build it into when we build it into our renewal, if we're building it into the pricing structure, we're doing whatever we have to do to enforce the accountability that the carrier provides the data to LAZ in whatever way we describe. So initially, before we met WellSpark, that was through a data file feed that was going to a different system for us to take a peek at our claims more holistically, and that was when we had our health coaches working internally. We then translated that and said, okay, now we'd like you to point that data toward WellSpark instead, into WellSpark's system. But we just wouldn't take no for an answer, and it can be done. And I think what happens as HR folks, and particularly, we get caught in the system, and we have to speak our minds and remind and hold our partners, our carriers, accountable for the fact that that data is ours and not theirs. And as our broker, as I mentioned, we've been very aligned to our broker on that methodology, and they've been bullish in helping us make that happen. And so I think it is the responsibility of the employer and the broker to hold the carriers accountable for who owns that data, because it can get confusing sometimes, and that doesn't always serve the employer. So being laser focused on accountability. No, this is ours. How can we make it happen? Even if we have to pay for it, it would be worth it. Although I would argue that I would argue that paying for it sucks. But if you got to do what you got to do in terms of paying for reporting, if that's what it takes. So
that's very helpful, Andi. Thank you. I know you've kind of outlined this model that you and WellSpark both really believe in, and can you tell us what's next on the horizon for you? When you started this process, you probably thought, okay, we're going to really revamp our health coaching model. We already believe in it. We know it works. Is there something else that you're planning to do?
Yeah, good question. So there's a few things. I think just as it relates in general to the health coaching model, and specifically around around medical claims and improving those, or our health costs in general. It does go beyond the cost of claims, and I think it's important to recognize that there are other things that we could be looking at that would help us to know whether or not that this type of program is successful. Are people feeling more engaged in their work? Are people feeling, if we see an increase in the number of visits to therapists, I would call that a win. It might be more in claims, but I would call that a win, because I would say that people are getting better care and they're taking their care more seriously. We're certainly tracking the compliance of our new plans. By the way, I didn't mention this. We had 93% of our total employees enroll in one of our, we call them the plus plans. I called them the value-based insurance design plans. We gave people an option, and we said, you do this. If you do this, you'll spend a little less. Your cost of care, meaning your cost of care will be less, and your biweekly premiums will be less. You don't have to. And so 93% of our population opted in, which we're very proud of. And I think that's important data. But from there, we're also tracking compliance to what we set out to do. We're giving you lesser cost of care, and as a result of that, we're asking you to do your preventative exams. We're asking that you do what you need to do if you have a chronic disease and manage that successfully. We're asking that you take videos through the LAZ Park central platform. So there's other tracking beyond just the cost of claims that we're really looking at on a regular basis. And so those things are really important. And then beyond that, and if you go to the next slide, I can share a little bit more about some of the other places where I do think employers have an opportunity. Self-funded not only on healthcare, but we're also self-funded on our workers' compensation programs. And if you've done any research on workers' comp, similar to health, when people are healthier, they come back to work faster after having an injury. So we started to brainstorm, Bert and I, and we were like, well, wait a minute, why not apply this same coaching model to our folks who are out as a result of an injury and see if they need some support, either getting back to work, health, literally physical health wise, or is there something that we can do to support them? Are they afraid of coming back to work because they don't think they'll get the support they need from their manager? Or are they potentially struggling coming back to work because they have somebody at home who wants them to stay home? I mean, who knows? There's so many different factors. But as a self-funded employer for workers' compensation, it behooves us. We pay the first $250,000 of every claim, and our average claim is $34,000. So for us to be able to move that needle, we know that when people go back to work more swiftly, then we're obviously going to pay less money on those claims as well. So we've just started some good dialogue on how we will be launching this impact study on workers' compensation, and hopefully we'll be launching that May 1st with the help of a claim, engaged in health coaching if they want to, voluntarily, of course, but we'll be doing some good warm handoffs. So we hope to see those numbers at least be significant enough for us to study, and the result of that hopefully will be not only cost of claims saved on the medical side, but also on our workers' comp side as well. And frankly, the model applies. If people are out on injury, or they still have lifestyle factors that potentially could be barriers for them to either come back to work or work as well as they possibly can. So those are some of the things that we have on our mind. And of course, there's lots of ways that we can measure our success through this and our healthcare model. As I mentioned, some of the ways on the healthcare, beyond just saving money on claims or getting people back to work more quickly, are people feeling more loyal to LAZ Parking as a result of them having had an active outreach from someone while they were out on a claim? I mean, Bert and Dr. Rollins talked earlier about human connection. Talk about a human connection. They're not only getting a call from their HR business partner when they're out on claim, or maybe their manager, but also they're going to get a call from a coach and be offered free support. That's amazing. And I would hope that that ends up showing that we, potentially keep our employees longer. We may see some improvement on retention. So I should also caveat to say, obviously LAZ Parking as an employer, we have people running cars, so our workers' compensation, we're getting people hurt all the time at work, but the type of business or the nature of the business that we're in, this is a place where we do see a high volume of claims for a large variety of reasons across locations around the country. So these are some of the things that we're working on in partnership with WellSpark. So far our results are really fantastic, and we look forward to continuing the process of figuring out new ways that we can support our employees through this whole biopsychosocial model.
And I think it's really interesting too, Andi, that your company is willing to support not just your full-time benefit eligible employees, right? So this is an opportunity for you to touch even more of your workforce that may not even have access to some certain benefits at times. So it's really a great opportunity.
Yeah, that's right. So yeah, and as Annie just mentioned, we quite a big volume of our workers' comp claims come from people who are not enrolled in healthcare because they are maybe part-time, not benefits eligible. So yeah, this will extend the WellSpark reach even beyond our employees who are eligible for benefits.
That's great. We actually got a question about, I know you mentioned some metrics early already, your early outcomes, which is, thank you for sharing that. We also had a question about just any like member successes, any success so far in your early program. And we happen to have a slide on that. So that was a great question, whoever asked it. If we flip forward, maybe Andi, you can just talk about one of the members that we've already seen some success with.
Yeah, I think Bert was going to talk about this one, but before we even go to this one, I can give you guys a couple of anecdotes, and then we can you can this slide. That's fine, and we can talk a little bit about this one. But a couple of just success stories that have come in at least my way anecdotally, beyond just the one that you're seeing on the screen. Before we go here, I just personally did an interview, I'll call it, with an employee who was so moved by his work with the health coach that he wanted to tell his story to LAZ to see if there's anybody else out there that might be inspired to get help as a result of seeing his story. He's a higher level director of operations, the national director of operations with our hospitality team, and highly visible within the organization. And he started working with a health coach a year ago, and his results, he told me he signed up to work with her and expected something entirely different than what he got, and he couldn't be more pleased with the results that he's had. He's learned to really navigate his work life more effectively, manage his stress, help his wife through a variety of different circumstances, show up in a more present way. I mean, there's different things he shared with me that span so much further beyond, his diet and his exercise. And he literally said to me, I will think twice before ever leaving LAZ, because this type of experience and the fact that I'm being offered this for free just by being an employee is significant. And to me, that's a win. That's a huge win. As the head of HR, to be able to look at an employee in the eye who's sitting here saying to me, as a result of this, I won't leave LAZ because no other company has this. And I think that's really powerful. I think Bert was going to share this story, or am I doing this, Bert? Sorry.
Yeah, Andi, we can certainly tag team, but this was a story that came through one of our health coaches, and the stories come through on a daily basis, and it's just it just really fills the hearts of the coaches and nurses who are really doing great work on the front lines. It just fulfilling our mission, and so this was an individual from your company that worked with a coach, and as you can read, she actually went into the hospital with a blood pressure of 235 over 119, struggling with her hypertension medication adherence, and she had a goal of losing weight, but had not put herself on a path to do that. And so in working with the coach, we unlocked some barriers to care and got her all squared away. We don't give medication advice. It's really important for us to let everybody know we are not doing hands-on care. It's all about make sure you ask your doctor about these things. But our nurses can answer some basic questions about medication. But then it was really putting Diane on a good path to health. She needed to at least stay engaged with a coach, a nurse in this case. But then started to walk with a virtual partner and got engaged and started walking, and 3 pounds in 1 month and lowered her blood pressure to 137 over 84. So feeling amazing is great. If only we had gotten to her before she went in the hospital, that would have been an even better success story. But the fact that we have engaged with her, put her on a good path, given her some skills, answered a lot of questions about her medication. This is one of many, many success stories that happens every day at WellSpark. So again, it's about identifying who the folks are, stratifying them to make sure we're getting the emerging risk, as I talked about way up front, engaging that participant in one of the many ways that we talked about. And then measuring our success, the success of the intervention, both on an individual basis, which is what we've done here with Diane, but as Andi said, on a macro basis, are we really helping that business solve for the business issues associated with an unhealthy workforce? Are we helping them save money? Are we helping them with absenteeism? And are we helping them with retention? So again, I come back to, it's the whole person, but it's also the whole ecosystem and how we're trying to work with companies to improve the health of their workforce so that they get better results all around.
And Andi, I can give you one more quick one that isn't on the screen, in addition to the two stories we've shared so far. This one, probably important for folks to know, our population, a lot English second language, many of them first generation American, and so didn't grow up with preventative care being comfortable. So we have a situation with an employee who had been found by his brother having in a diabetic coma in his apartment. His brother just randomly happened to stop by and found him in a diabetic coma, ends up going, didn't know obviously it was a diabetic coma because he didn't know he had diabetes, ends up going to the hospital, blah, blah, blah. Anyway, diagnosed with diabetes, comes home with all this medication, not sure what to do with himself, sugar through the roof. And our health coach reached out to him because he showed up on the list of folks with chronic disease. And she told me the story and said that when she called him, he said he had been praying for a miracle because he didn't know, and he had no idea. He was even diabetic. He didn't know how to navigate the system. He didn't speak English well. And here she called, and she was his miracle. And to me, I get chills. Maybe it's because I'm attached to these employees at LAZ, but I think it's just such a beautiful story that demonstrates the power of how important, how powerful and important it is that we remember that at the end of the day, what we're doing with WellSpark is about helping people. And this person now on a good track for his own health and well-being, which obviously we're thrilled about. But I'm moved by that story, and as Bert said, they come in every day and they're countless.